Welcome to Voices on Radio Zindagi, 11:70 a.m. And today we're here to discuss a very important topic that has all of us rattled at many levels. And that is the excruciating COVID crisis in India. On March 24th, 2020, Prime Minister Modi asked 1.3 billion people in India to sit home for 3 weeks in the most severe action to stop the spread of COVID-19. For 3 months, that the lockdown was extended for, it affected the lives of millions of people who live below the poverty line and those who live hand to mouth. The impact was devastating. We remember images of people leaving the urban areas. It was sort of disastrous to a certain extent. After that initial overreaction, Modi took his foot off the pedal very quickly. There was an extraordinary hubris of the Indian government to be declaring victory much too soon, proclaiming that Indians were perhaps exceptional to have some kind of natural immunity to COVID. And then they decided not only to celebrate, but also to allow massive gatherings, political rallies, and of course the cricket tournaments and religious festivals. And India started behaving like COVID was a thing of the past, while the experts kept warning of cases being on the rise. All this created a kind of out of control situation. More people are falling sick than what the hospitals have infrastructure for. Right now, there are not enough hospital beds, oxygen supply, medicines. Soon, there will not be enough doctors and nurses. This is the exact catastrophe we all have been staying at home for in the first place. India is a dynamic, flourishing, energetic private sector and a very dysfunctional, weak public sector. And in a public health crisis, the public sector must perform. But the response remains episodic and not strategic. There is no national strategy or vision, and the chaos of thought, process, and planning is criminally killing people. And there seems to be very less people in local media and political leadership who are willing to hold this administration accountable. The government has felt very less pressure to do something and is busy in its own efforts taking down Twitter and Facebook accounts that are critical of them instead of apologizing, resigning, and even reorganizing. We're going to have a very honest discussion about the situation on ground, and this is not a political critique. It does not matter to us which politician or ideology you support. We're talking about a public health emergency that can affect the entire world, not only India. Our friends and families are in crisis, and there seems to be no end to this except death of millions. Before we figure out how we can, as a diaspora, really help them long term, we need to find out what the real issues on ground are. We have with us an extreme panel of guests. We have Hartosh Singh Paul, the political editor of the Caravan magazine, Amrit BLS from The Wire, Sanjeev Goyal, a Silicon Valley technologist and philanthropist, and Dr. Shweta Das, who's the medical director at the Contra Costa Regional Medical Center Lab. The show is multicast on our Facebook handle, which is Radio Zindagi. We are again broadcasting on Radio Zindagi 11:70 a.m. and our studio number is 510-657-1170 should you want to ask us any questions while we're live. And a note, before we get started, because we know we're going to get a lot of comments, we live in an ethnically rich and diverse multicultural world, and we value diversity of opinion and thought. Use of language that could be construed as offensive, derogatory, or personally disparaging towards others is unacceptable in the comments to this thread or this broadcast. We look forward to your participation. Please send your messages, comments to us while we're broadcasting. So here we go, live over to you. Let's start with Hartosh. Hartosh, we've seen varied accounts of what went wrong, some really in-depth and some at the top of it. But what we're really seeing is, the levels at which this has been covered. It is devastating. What really went wrong is the basic question we need to understand.
Well, in short, everything went wrong. But it starts right at the very top. I had in another context after demonetization said about Amit Shah and Narendra Modi that these are men who would be great at leading us into disaster. They would be awful at leading us out of it. And this is what we are seeing. This obsession with self-promotion and absence of real action on the ground, unwilling to take action when it was clear something was going to happen, unwilling to take action even after things have happened. Now we are 1 month into the spike. We are well past the point where we've been pointing out that we had a year in between to do something. We've had a month to do something. The oxygen situation. People are dying unnecessary deaths. The large majority of those deaths were preventable if oxygen were available, leave alone hospital beds, oxygen at home. Numbers are being undercounted because there's not enough testing. We don't know how long this will last because we don't know what the figures are. The death count, hugely underreported because our reporters on the ground at cremation grounds, the vast majority of deaths are not being registered at COVID deaths. All this to save face. And in saving face, you are ensuring the death of thousands more. And this, in some senses, is a culpability right at the top. That's where the problem actually starts and ends. If anything has to happen, we have to see action from the top. We have to see governance, we have to see leadership. All of it has been missing.
Amrit, what do you say?
Yeah, I agree with what Hartosh has said. And apart from, I think, the failure to react or to prepare for the crisis, the other crisis has been uh, the failure to effectively roll out vaccination program. Because I was reading this book that has been released recently. It's by this lady called Abantika Ghosh. It's called Billions Under Lockdown. And she has documented that the government effectively wanted an indigenous vaccine because they have this new policy which is called Atmanirbharta or self-reliance. So instead of approving vaccines that have been approved elsewhere, like Pfizer, like Moderna, or Johnson and Johnson, they wanted to have an indigenous vaccine, a vaccine that was manufactured and engineered here in India, because they wanted to drive home the point that we do not need any outside help. We do not need anything. And we can see the consequences of this failure today because there is a shortage of vaccines today. Technically, every adult is eligible to receive a vaccine in India today, but everywhere across the country, the people are queuing up in the hope of finding a vaccine, but many of them are being turned away. Even after you book an appointment, when you go to the vaccination center, you're told that there's no vaccine available for you today. And people who have received the first dose, they're going back to get their second dose. Even those people are being turned away. It's not just people trying to get their first dose. It's also people who want to get their second dose but can't because there is a massive shortage of vaccine, and the situation is likely to continue for another couple of months at least. So I think that's another major aspect of what's caused this whole crisis.